presentation on acute respiratory infection.
Good evening, everyone. First of all, I would like to thank you for being here, and thank you for all your work and teaching us all this new information. My name is Oluwatamilore Aladini. I would like to tell my personal story of acute respiratory infection. Growing up as a child was really hard for me. I was born and raised in Bauchi, Nigeria. Finding healthcare in Nigeria was very difficult. I vividly remember when I was 7 years old, I was diagnosed with a severe case of pneumonia. Ever since my condition, my parents tried to find a hospital for me to get treatment, but couldn't find the hospital for me due to lack of space and lack of resources. I remember my mom always carried me on her back, crying and begging doctors to please give me the treatment for my case. But I couldn't get the treatment until I was about to take my last breath. My team and I today have prepared this presentation not only to talk about acute respiratory infections, but to raise awareness about the detrimental causes it has on people, children, and families.
So now that we established this personal connection our team has with ARIs, I've decided to kind of explain for maybe some other people who may not have this similar personal connection. So why ARIs? Why are they important? ARIs are especially prominent in Nigeria due to the fact that there are over 260,000 cases as well as 3,000 deaths alone in Nigeria alone. This is really important because there are many factors that contribute to these large numbers, such as improper conditions that are due to sanitation issues, not sufficient enough health education, as well as just the government infrastructure that is placed in Nigeria that may cause some communication issues between citizens as well as the government that can cause increased infection rates of ARIs. So we hope through this presentation we can encourage Nigerian citizens to wash their hands, in place proper sanitation regulations that can decrease infection rates.
So what exactly is an ARI? An ARI is also known as an acute respiratory infection, and ARIs are a disease that can be present in the respiratory tract, and some symptoms that can define this type of disease would include nasal congestion, sneezing, and coughing, but we will further dive into this disease throughout the presentation.
This is our table of contents and the order that we will be following throughout the presentation. We will be starting with health literacy, then moving on to prevention, then we will have treatment, and then we'll go over our budget.
How are ARIs transmitted? There are three main ways that ARIs can be transmitted from person to person: contact, aerosols, and droplets. There are two forms of contact, direct and indirect. Direct contact refers to human-to-human contact. So a susceptible person comes in contact with an infected person. Indirect contact refers to a susceptible person coming into contact with a contaminated object. Aerosols are very, very small, like droplets that can stay in the air for a long time, so people breathe them in. Droplets are larger particles that can travel really far, like approximately 6 feet. They contaminate objects and are transmitted by indirect contact. Aerosols and droplets are expelled from people when they cough, sneeze, talk, or even sing.
So what exactly are common causes of ARI? The most common cause of ARI is the respiratory syncytial virus, and there are also two different categories of the ARIs, which is the lower and the upper respiratory tract infection. And not only are these different types of causes for an ARI, but there's also risk factors that may contribute to how prone somebody is to contracting the disease. So first off would be the constant interactions people have with each other, and this includes people greeting each other, shaking hands and hugging each other. As I personally heard earlier throughout the week, Umar said that he was greeting somebody who he necessarily didn't want to shake their hands with because there was placement in areas that weren't as clean as he wanted them to be, but he didn't want to ignore it because he didn't want to be rude. So people can have situations like these and not necessarily wash their hands or sanitize their hands after because they may forget. And then some other risk factors that can be included would be fewer resources. A lot of people may not have the means in order to go to the hospitals or have the salary in order to pay for any of their treatments. And lastly would definitely be people being unaware of what to do when contracting diseases like these, especially ARI. A lot of people may resort to other forms of medicine, as Dr. Aisha has told us before. They may resort to herbal medicine, and other factors like these can help, or other factors like these are definitely contributing to people being more prone to contracting the virus of ARI.
So the most common types of ARI is tonsillitis, as many of you might know, it's common cold, COVID-19, ear infection, and pharyngitis and laryngitis. Okay, so as many of you know, is common cold is laryngitis. So the symptoms of that is stuffy nose, runny nose, sneezing, and itching. So symptoms of common COVID-19, which we've all been dealing with for the past 2 years, is cough, shortness of breath, loss or taste of smell. So for ear infection, is inflammation of the inner, middle, or outer ear, often with infection. So acute pharyngitis, symptoms, pain, scratchiness, and the throat difficulty swollen. And then laryngitis, an inflammation of the voice box from overuse, irritation, or infection.
So to discuss short-term and long-term effects of ARIs, I want to talk about first their physical aspects in the human body, such as damage to your heart and brain, but you also have to consider the overall government infrastructure that can be affected by ARIs. Especially in our situation right now, we can see that the health industry is going to be much more significantly highlighted because of diseases such as ARIs, since the government has to implement new solutions, new maybe vaccinations, new cures, and other forms of medication to find a way for citizens to recover or kind of overcome this barrier of ARI specifically. So we can see that in the long term that there is definitely going to be a lot more government intervention in citizens and their health and their overall wellness and their education about diseases such as these, which will cause conferences like these to be held, and hopefully more citizens will learn about diseases that may not only be ARIs.
So just to talk about these social determinants of an ARI. So ARIs are most common in areas with poor living conditions, poor nutritional conditions, and also in overcrowded living conditions. And ARIs are most common in children because of lung development, also lower immunity, and specifically children in developing countries that live in poverty or low-income families are unable to receive adequate health care to treat their infections. And specifically in Nigeria, some reasons why ARIs spread are through the use of unclean cooking fuel, as well as inadequate sources of water, and also people living in houses that were built with low-quality materials. And finally, parental education, insufficient breastfeeding practice, and also attendance to daycare centers are the main reasons why children contract ARIs in Nigeria.
Okay, so I'd like to introduce the community workshop that the ARI Health Literacy team worked on. So the main function of the workshop is to have every member walk out of it more familiar with ARI than they were when they walked in. So this could be in the form of obtaining a greater understanding of how the disease is caused, the symptoms of it, and understanding the transmission. Additionally, our team felt very inclined to specifically target children in this workshop, and we plan on doing this by having our workshop comprise mainly of parents of young children. 70% of ARI-caused deaths are linked to children under 5 years old. This is obviously a devastating fact, and by giving valuable information to the parents who often have at least 2 or 3 children, we'll be able to hopefully impact the lives of countless children across northern Nigeria.
I'll be going more into depth about our 2 activities. The team of health literacy made our own video about what we want to do in our first activity. Go for the video and I'll explain while we're talking. Turn the volume down. So everyone is going to be provided a bowl, some water, a bit slower, some water, also ground pepper. Okay, and then they'll begin the experiment by pouring the water in the bowl. Next, they will ground a reasonable amount of pepper on top of the water. This pepper is used to represent germs that everyone can come into contact with during a normal day. So now our hand model will be testing the germs, and you see how they got on her finger, and she has no way to get rid of them. Now she'll be dipping her finger in soap and then putting it into the solution, and then we can watch what happens. Wow. So now we can see that all the germs floated away from her finger. There we go. Floated away from her finger, and she was able to protect herself from all the germs that she came into contact with that day. So everyone will be able to do that hands-on, which is a really nice experience that everyone will be able to have. And then our second activity after our experiment will be a guided conversation with everyone there that will work to unite them under the fact that they all have children who are vulnerable to diseases such as ARIs. And hopefully we'll teach them on ways to combat this and alternative methods to protect their own children. And then lastly, we will be providing them with note cards so they are able to quickly go through this with their children whenever they return home. It will be very simple with just pictures on them.
So now prevention of ARIs. The prevention of ARI is very imperative to the residents of Nigeria and other developing communities surrounding it. Because there is minimal treatment for these diseases, it's very important to take precautions that are very easy and simple lifestyle changes that you can that can make a whole lot of difference.
So why is education on the prevention of ARIs necessary? So it's necessary because even if someone is able to identify whether or not they have an ARI and be able to identify signs and symptoms within themselves and their own family members, 4 out of 10 people in Nigeria live in poverty. Those 4 out of 10 people may not be able to afford the treatments that we are going to recommend. So in our opinion, we think that prevention is the best way to avoid the disease and more complications such as fatalities. We were all here when the COVID-19 pandemic hit the United States in 2020. We all had access to vaccines about a year after it began. In Nigeria, only 14% of people are vaccinated due to overcrowded hospitals as well as a lack of resources, compared to 72% in the United States. By doing our workshop, we hope to educate people on the prevention of ARIs as well as help them avoid them in the future.
One way to prevent an ARI is by simply washing your hands with soap and water, and that can prevent germs to spread to surfaces you or other people.
Also, avoiding the ARI is contact with sick people. This may also include your family members. This is important because it creates a safer environment not only for you, but your little ones.
Wearing a mask is also a way to prevent ARI because, for example, wearing a mask can also prevent an ARI, for example, COVID, by avoiding infectious droplets.
Lastly, this includes personal hygiene. You might think it's just showers and brushing your teeth, but this also includes using your elbow when sneezing and coughing.
So for the prevention workshops, we've decided to start our activities with a 2 truths and a lie game to kind of clear up any misconceptions that the community may have about like how ARIs are contracted and like what you can do to prevent them. So the facilitator will start with a note card that has, and they will read the 3 statements on the note card that would be considered common things people hear about ARIs, and one of them will be false. And since these are such common statements you would hear, it makes it a little bit more difficult for the participants to find which ones are false.
For the second activity, it'll be more of a demonstration. So there will be a line or a circle of people, and one person will come in coughing, fake coughing, and they'll have powdered red chalk on their hands. They'll shake the person's hand who's next to them, and then that'll create a chain of people shaking their hands. And at the end of the chain or circle, every single person will end up with red chalk on their hands. And that is representing the spread of ARI. At the end of the chain, everybody's going to take a wipe. They're going to wipe off their hands, and this is going to represent how simply washing your hands can end the chain of infection.
So just to summarize everything that we did throughout our workshop, we would have the facilitator lead a group discussion talking about what they've learned and asking the participants if they feel like what they've learned has impacted them, such as if it will affect how they view ARIs and how they would view what they would do if their child contracted one, as well as the participants would fill out a post-test just to see how effective our workshop is. And at the end, all participants would be given water, hand sanitizer to get off that extra red chalk, and some flyers with some helpful information about what to do and how to prevent ARIs.
Okay, so it's important if you want to treat something, you first have to find the difference between viral and bacterial. So typically, when you have viral, you technically have a lower grade fever. So if you feel like you want to test yourself for ARI, or even when the doctor is doing it, they will technically look, if they're trying to find the difference between viral and bacterial, they will, if they're looking for viral, they will find a lower grade fever with the numbers on the screen. As you can see, if you compare them to bacterial, well, they're significantly lower. And if you talk more about viral, it tends to affect the lower respiratory system, which is area near the lungs. And also, you can even do this yourself. So if you think you have any sort of ARI, or if a doctor is diagnosing you, they will ask you, like, what is your cough like? And if you have a drier cough, per se, they can conclude that you have a viral ARI. Another symptom that you can find the difference between viral and bacterial is that, well, technically, less mucus occurs when you're having viral, considering the fact that it is, a dry cough. And finally, viral is going to be treated with supportive treatment, which will be talked more in the next slide. So if you want to maybe do this by yourself, if you think you have maybe any symptoms, you can technically look at this and you can find the difference and distinguish. Even without a doctor, you can do it by yourself if you have viral or bacterial.
All right, now I'm going to do bacterial. So I'll be talking about the bacterial symptoms. So while there are not very differences in the symptoms, there is a difference in the production of these symptoms. So this helps doctors distinguish between bacterial and viral ARI when they're diagnosing a patient. So basically, as Stefan said, a higher grade fever will occur when you have a bacterial infection with a fever around 36.8 Celsius and 105 or 103.5 Fahrenheit. So this is a really common thing to look out for, and it's also very helpful when diagnosing a patient with bacterial ARI. So it will also affect the upper respiratory system, which means your nose, your mouth, and your esophagus. So as this is where most of the mucus occurs. And the sputum, or your mucus and phlegm, it will be a lot more green or brown, colorful, and it will smell a lot worse. So it's very obvious for a patient to tell by themselves if they could have a bacterial ARI or a viral ARI. So also, since it is in the upper respiratory tract, since you have more phlegm, it will be building up in your nose and maybe your throat, and you'll feel a lot more, which could lead to congestion and headaches. So because of this, we can treat it, and since it is bacterial, we can treat it with antibiotics, which will be talked about in the next slide.
So now what do you do if you have a bacterial ARI? Well, our treatments would include antibiotics. So an antibiotic you could use would be amoxicillin. But if you are looking for something different, you could also get steroids, which would have to be prescribed by a doctor.
We also have viral ARIs as opposed to bacterial. And viral ARIs cannot be treated, as we know, but we can do something to shorten the duration of your illness. So making sure that you're staying hydrated, making sure that you're getting adequate sleep, and making sure that you're eating vitamin C rich foods, as in oranges or grapefruits, will help shorten the duration of your sickness.
Okay, so we want to take into account that not everybody will be able to get the treatments, especially for bacterial ARIs. So some local remedies that we suggest people can do is honey for your sore throat, or gargling with salt water, and ginger tea with mint, and inhalation just to alleviate some of those symptoms like sore throat and a tight chest and congestion. So I'm going to give a little bit of an overview of what our ARI treatment workshop will be. It's targeted for adults so that they can learn the symptoms of an ARI and how to treat them, especially if they contract it or their child does, because ARIs mainly occur in children. So we want everyone to be safe.
Up first in our workshop list is a memory game. And this memory game will be for 30 people. And 30 people will get into 10 groups, so trios, and each trio will get a deck of cards. And in that deck of cards, there will be 14 matches, if you will, and they'll put it into a rectangular shape with the words facing down, and they'll go in a circle or take turns, and they'll take 2 cards at a time. If their question and answer match, then they can just set it aside, and whoever gets the most amount of cards wins. These memory cards will help reinforce the different types of treatments between viral and bacterial ARIs.
The goal of our second activity is for the participants to practice their communication. They're going to be role-playing, and they're also going to be performing a diagnosis. How it's going to work is that the participants are going to be split up into 2 different groups. Group 1 is going to begin as the doctors, and Group 2 is going to begin as the patients. And they're going to be paired up, so one doctor and one patient are going to be paired up. It's the patient's job to accurately describe a viral or bacterial ARI to the doctor, and it's the doctor's job to diagnose whether it is a viral or bacterial ARI and prescribe some treatment for them. And again, it's just a really great way for them to practice their communication.
Okay, finally we have crosswords. I don't know about you, but I love crosswords, the nostalgia of doing in the Sunday paper, and additionally, this will test our participants' knowledge on the differences between bacterial and viral ARIs, the symptoms of bacterial and viral ARIs, and finally, and most importantly, the treatments associated with them. Okay, so here is our budget laid out in a pie chart. Okay, so for materials, that is $189 also, and that's going to be 12.6% of our budget. And for transportation and food, those are going to be $262.50 each, which is approximately 17.5% of our budget. And finally, and most importantly, 40% of our budget is allotted to a copay program. What is this copay program? We are going to pay for not only the treatment but diagnosis of the patients for how much that can do, and we're going to pay for 50% of that to ensure that we have more miracles such as the one that we discussed at the start of this presentation.
That was the end of our presentation, and first we'd like to go through everyone's names. So just starting from that side and going down this side.
I'm Chloe.
I'm Dakota Palma.
I'm Maya.
I'm Melina.
I'm Tario.
I'm Cheyenne.
I'm Riddick.
I'm Stefan.
I'm Annabelle. I'm Tessa.
I'm Sophia.
I'm Elliot.
I'm Olivia.
I'm Aisha. I'm Lily. I'm Olga. I'm Laura. Also known as Candy. I'm Jordan. I'm Alex.
And I'm Alette. And we'd lastly like to say we need your support. Everyone in this room plays a role in the way that we treat and deal with ARIs, from everyone on the stage who did extensive research about the topic to all of you sitting in the audience. The education that people have on ARIs is extremely important. And we heard a personal story from Tammy, and we want everyone to notice that this is not as far away from us as it seems. There are people among us who have dealt with issues like this, who have sought treatment and have struggled to get it. And we would like people to be aware of the detriment that not seeking treatment can cause. Thank you for listening to our presentation.
All right, this time around I think we'll start with Umar.
Okay. Well done, guys. This is really a very beautiful presentation. I'm really proud that you make it very, very simple, because I think even though talking about COVID, comparing it with ARI, the complication, it's really it's really difficult to kind of separate the two. But you are able to actually put it in a simple way that people can really identify what ARI is. And the most important thing is passing the message, especially for the locals to understand what ARI is all about. And I really love the presentation because it's straightforward, and it's not really going to be difficult for the audience to really understand what you guys are trying to do. Wow, your video simulation. I don't know who came up with that, but that was really incredible. So I know sometimes it's, videos actually speaks more to people, and kind of showing that to the audience that, hey, so this is the virus, and this is exactly, if you take these measures, it's kind of going to stay in their memory, so they will never forget. And this is the most important thing that you want them to take home with. So even though you have flyers and everything, but I'm telling you, if they close their eyes, they will keep looking at that video, and it's going to scare them to death that, oh my God, we're at risk. So a very, very good initiative. Thank you so much for showing that. And that magic, I would like to try it as well. Yeah. Again, one thing is that you understand the poverty level of the people, which is very, very key. So you consider people who can afford medications and those who cannot afford medications, and you come up with a solution to people who cannot afford medications to use local remedies. And even understanding that if they can't afford medical bills, they should try as much as possible to prevent themselves from contacting with ARI. So, which is, I think there is one statement that said prevention is better than cure. So this is really incredible. I'm really proud that you were able to pull that together. And again, the simulation between the two of you, I can't even say these are the the what team are this? You guys work as a team all together. I mean, like you didn't separate yourself from one another, which is amazing, because you're all trying to address one issue at the end of the day, and that is the goal. So I'm really excited that you guys were able to go. Tammy, I don't know where you get that story. Is that your story or that your story?
My personal story.
You live in Bauchi?
I was born and raised in Bauchi.
Seriously? Wow, that was really amazing. It's incredible. So I was kind of like, okay, am I in a different world or am I still here in DC? So it was really amazing, and thank you for sharing your story. And this is exactly what we're looking for. And I think as part of your presentation, you had mentioned that one of the participants are going to kind of like speak out, and the community, the engagement exercise is very, very important as well, just to make sure that they understand what is really going on. So thank you for sharing your story, and you guys have really, really done a great job. I'm really proud that you made this week through with a very good ending. So thank you so much.
Awesome. Dr. Aisha?
Okay. Thank you, the ARI team, for this wonderful presentation. And the video was really amazing. It made a lot of sense. It was simple, okay? It required very affordable and very common equipment and resources. So it's something that I foresee to actually make a huge impact, because, of course, you guys highlighted the poverty level. So what you're proposing or what you came up with has a high chance of making a difference and being accepted. Okay? First of all, I was expecting your names before the presentation, just like the other group did, but nevertheless, we got to know you all at the end. So the literacy team, you guys did well. Of course, I always pay attention. I mean, I pay attention to everything, but literacy, you know, I pay more attention to literacy and prevention, because I feel, don't feel left out, please, the treatment group, okay? So, literacy team, I pay special attention because education, they say, is power, okay? And when you're well informed, you have a better chance of making more difference, okay? Even for yourself, okay? ARI is quite common. I like the fact that you included COVID-19 and all of that, but the risk factor, you didn't mention immunosuppression, those who are immunocompromised, and those with other illnesses, comorbidities. This is very, very important, because I'm sure some of us here have one or two other conditions, coupled with the fact that we have common ARIs like the rhinitis you mentioned, and other comorbidities are very common. So it's very easy. I'm sure during your diagnosis, you might have found a patient with more than one disease, okay? So other comorbidities are really important in highlighting your risk factors, because somebody with asthma, for example, or diabetes or hypertension, you want to pay more attention to them, because they are at the highest risk of debilitating consequences of ARI, okay? Like I mentioned, the video was amazing, and well done for that. The treatment and prevention group, I also paid attention, okay? For the treatment group, I saw 36 degrees centigrade and 100 and something. Like I said, I always pay attention. I only know the temperature in degrees Celsius. I don't know Fahrenheit, okay? 36 degrees is not considered fever, and I saw it there. Low-grade fever It's not 36%. I remember writing it on the board. 37.2, 36.7 to 37.2 is normal temperature. Okay? So above 37.2 is fever. Okay? So your activities, the idea was amazing, but there was so much text. Okay? So even for, I don't know, I think the LI staff back home might find it difficult to actually go through. So I think a bullet point as well as graphics, or videos would have made more impact, or made it easier for people. Okay, so it's for both the prevention and the treatment group. The ideas of your activities, which is what every other thing you're saying is the information is out there, but what you guys are proposing, the idea you guys came up with is amazing, is awesome. Okay, so I would have appreciated more graphics or pictures. Okay, just pictures to show, people shaking hands and then having the paper. It would have been more entertaining. Okay, all in all, it was wonderful as usual, and I'm proud of you guys. You did amazingly well. I like the confidence all of you brought here with you. Okay, and well done and congratulations. Thank you.
Yeah, I'd love to echo Umar and Dr. Aisha. The activities, the video, they all went far past the mark at what was needed to demonstrate and illustrate and give people that visualization, like the chalk on the hands, of how ARIs work, how they're spread, how to prevent them. That's the most important thing, because you can explain things, but if people don't understand it in their mind, how it works, it's not going to land, it's not going to stick. So all the activity designs for all three groups, all of the visuals were crafted in order to do that. So that is no easy feat. I know it's not easy to try to teach people things, working with all of these different factors you need to consider. And you really, really, really hit it on the head. And of course, the personal story, Tammy, at the beginning was moving. It sets up the presentation phenomenally, and it's really amazing that you have that connection. And so overall, this presentation just was awesome. Like, that's all I have to say. It was really, really great. So congratulations, everyone.